Let us continue the barbiturates. The adverse effect or side effects of barbiturates are hypersensitivity reactions, idiosyncrasy. Idiosyncrasy is an abnormal physical reactions to the drug, dependence, hangover with long-acting barbiturates, and enzyme inducer activity is an adverse effect. The acute barbiturates toxicity includes the coma, hypothermia, decrease in the body temperature, decrease in the blood pressure, and the respiratory depression. Treatment of acute barbiturate toxicity. We need the antidote for the barbiturates, and the antidote for barbiturates is bemigrid. So this is also useful for your uh, MCQ, which is the antagonist for the barbiturates. So bemigrid is barbiturate antidote or antagonist of the barbiturate receptor, and which is the antagonist for benzodiazepine is flumazenil. Treatment of acute barbiturate toxicity. The first step for the all types of the oral poisonings are gastric lavage and use of activated charcoal to adsorb unabsorbed drugs. Care of respiratory by the suction of the secretions which are available in the respiratory tract to avoid the blockage, endotracheal intubation, and artificial respiration. Care of the circulation if the blood pressure is severe decreased by use of the plasma expanders to increase the blood pressures. And as the barbiturates is the acidic drug, the alkalization of the urine is the most important concept to excrete the drug from the body. And hemodialysis is needed as barbiturates are highly bound to the plasma protein and rapidly reabsorbed from the kidney. So the drugs which bound to the plasma protein may leads to long duration of action, and to prevent this the long duration of action, long duration of toxicity, the hemodialysis is preferred. An antidote is bimigrid, which blocks the barbiturate receptor. So these are all about the benzodiazepines and the barbiturates. Now the third category is a miscellaneous category, other than the benzodiazepines and the barbiturates. In the miscellaneous category of anxiolytics and hypnotics, Buspirone is used. The Buspirone is generally act via 5-HT hydroxytryptamine, or we can say serotonin. So it is a serotonin receptor agonist, 5-HT1A partial agonist, which is having anti-anxiety and antidepressant effect. and it is generally not used in the treatment of acute anxiety, acute sudden, because the initial anxiolytic effects are observed within first 7 to 10 days, and optimal results need 3 to 4 weeks. So drug to be act in need the more time, but in the case of the acute case of anxiety, we have to need the medications for sudden, or we can say for emergency management. For anxiolytic effect of buspirone, we have to wait for 7 to 10 days, and which is not practical. So it is not used in the management of acute cases. Generally, it is useful in the older patients with other medical conditions, chronic medical conditions, because the CNS depressant activity is less. It lacks the CNS depressant effect of benzodiazepine and barbiturates. And buspirone is an effective as benzodiazepine in the treatment of the GAD. GAD. GAD is generalized anxiety disorder. Generalized anxiety disorder. And it also improves the sexual functioning in the patient with the generalized anxiety disorder. The generalized anxiety disorder in the patient, in the person who is who is thinking abnormally, abnormal thinking. What happened? What happened if I am the fail in the exam? What happened if I left the medical education? What happened if my brother? What happened if my mother? What happened if my son? What happened? So these are the questions in the generalized anxiety disorder. So, and this generalized anxiety disorder need the long duration of treatment. So the buspirone is one of the best because it does not having the sedation, we can say CNS depressant as an adverse effect. So it is generally used in the management of anxiety, and we can say the drug of choice in the elderly. And plus, in addition to this, when there is a anxiety, in the anxiety, it relates with the depression. When the patient or person think abnormally with the anxiety, it may leads to depression. So it is a best drug for the persons who has anxiety and to prevent the depression. Side effects: delayed onset of action, so it needs 2 weeks to be effective. Dizziness, tachycardia, and hypersensitivity are the other adverse effect of buspirone. So if there is a tachycardia, if the patient of the cardiovascular, the great caution should be taken. Beta blocker. Now we know that the beta blockers are used in the management of hypertensions on and other cardiovascular disorders. The beta blocker generally used in anxiety in performance related situations. We can say in the performance anxiety. So suppose if you have a seminar, if you have a exam, if you have an interview for your job, then the person has the performance related anxiety. What happened in the interview? Which questions they will ask to me? If they will able to employ me or not? what happened in my seminar, I will get full marks or not, I am able to talk or not. It is performance related anxiety. And generally, the drug should be taken 1 hour before the performance or anticipated anxiety, and it will decrease the physiological symptoms of anxiety like the tachycardia. What happened in the seminar during the performance of like the seminar or interview? There is a tachycardia, there is a sweating, there is a blushing, and there is a tremor. And we know that this to avoid the palpitation and tremor, this beta blocker example is a propanolol. We are already used in the management of the hyperthyroidism cases. In the hyperthyroidism, for the symptomatic management of the palpitation, tachycardia, and the tremor, we are using beta blocker. Same. And it act by decreasing the peripheral autonomic symptoms of arousal. For the patient with the performance anxiety, 10 to 80 milligram of propranolol or 25 to 100 milligram of atenolol taken 1 hour before the performance as needed. But remember that don't take at the first time by searching the online literature. A test dose should be taken at home before the presentation to ensure that a beta blockage is sufficient and there are no adverse effect. Otherwise, if the person take the first time dose and in the performance, he will be having more difficult adverse effect. So from the category of beta blocker, propranolol or atenolol can be used. The first generation antihistaminics, antihistaminics generally act by the blockage of the histamine receptor, diphenhydramine and promethazine, and these are used pre-surgically for their C2 and muscarinic receptor blocking actions. Antihistaminics to decrease the secretion in the surgery, so it is used pre-surgically to reduce the secretions. Paraldehyde and the chloral hydrates are also used as hypnotics, but the, these two drugs are contraindicated in the peptic ulcer. If the person having the peptic ulcer, the paraldehyde and the chloral hydrates are contraindicated. Plus, paraldehyde is also contraindicated in the pulmonary disease, and the chloral hydrate is also contraindicated in the liver and kidney disease. Both drugs are used as an hypnotics. Zopiclone is also hypnotic drug from the miscellaneous category, and it is structurally unrelated to the benzodiazepine. It's bind to the benzodiazepine receptor, but at slightly different site from the benzodiazepines, and increase the action of GABA on GABA A receptor. So it is a neighbor. It is a neighbor. It act on the different site from the benzodiazepine, not on the same site of the benzodiazepines. That's why it is miscellaneous category. But due to neighbor, there is some advantage, and it activates the GABA, zopiclone. It is having bitter taste, and it is having the same side effect like the benzodiazepines. Zolpidem, it is selective agonist on benzodiazepine 1 receptor. It is a hypnotic drugs. It is used in treatment of sleep maintenance insomnia. It has rapid onset and few amnestic effect, loss of short-term memory. And zolpidem has T half near about 2 hours, which is insufficient to cover the most of typical 8 hour sleep period. So generally the sustained release doses are used for the person with waking in the middle of the night. It produces the weak muscle relaxing and anti-seizure effect. And this zolpidem, which are the benzodiazepine receptor agonist, should not be used more than 4 weeks due to the dependence, tolerance, and the misuse of drug. As it is a benzodiazepine receptor agonist, benzodiazepines receptor blocker like flumazenil is an antidote for zolpidem. And if this drug is, or any sedative drug is administered late night, administration of the zolpidem, there is in the morning sedation, delayed reaction time, and anterograde amnesia. Anterograde amnesia means unable to take new things, unable to remember the new things. It is anterograde amnesia. Zaleplone, these all three drugs having the start with the Z. So this may be useful for your MCQ. You have to remember the name. It is the selective agonist on the benzodiazepine 1 receptor, same zaleplone also. Hypnotic drug rapidly absorb and reaches the peak plasma concentration in 1 hour. So used in the sleep onset insomnia. So zaleplone has a shorter T half 1 hour, and the safe dosing later in the night is required. So this zaleplone and zolpidem, this act on benzodiazepine 1 receptor, and another Z, zopiclone. And the zopiclone, these are generally structurally unrelated to the benzodiazepines. So this is a miscellaneous. Remember, the zopiclones are the clone. Clone means clone. What is a clone? Duplicate. Zopiclone, clone means duplicate. So you have to remember by the name clone means duplicate. So it is structurally unrelated. And zolpidem and the zaleplone are act on benzodiazepine 1 receptor. The panic disorders, it is treated effectively with the several drugs including selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors like the fluoxetine, paroxetine, sertraline, and the selective norepinephrine reuptake inhibitors, that is SNRI, venlafaxine, and the TCA, that is tricyclic antidepressant, imipramine, and the benzodiazepines, alprazolam, and the clonazepam. So in the panic disorder, generally there is a depression, and for panic disorder in the depression, we need antidepressant drug, antidepressant drugs. So here, this is not our topic for sedative hypnotics. Antidepressant is another category. And in antidepressants, there are three categories of drug: selective serotonin reuptake inhibitors, fluoxetine, paroxetine, sertraline; selective norepinephrine reuptake inhibitor, venlafaxine; and tricyclic antidepressant, TCA, imipramine. But the benzodiazepines, alprazolam, and clonazepine are also approved by the FDA for the treatment of panic disorder. That's why we are mentioning here. And it is already discussed about the panic disorders. GAD is a generalized anxiety disorder. Antidepressants are the drug of choice for the management of the GAD, because when there is a generalized anxiety, there is abnormal thinking, and this abnormal thinking may leads to depression, uncertainty. If the questions, what happened next, what happened next, if there is a questions, abnormal thinking, so it may leads to the depressions. So antidepressants are the drug of choice. So anxiety is also managed by antidepressant drug with some sedative and hypnotics. Anti-anxiety effects of antidepressants in the generalized anxiety disorder occurs after 2 to 4 weeks, and full therapeutics at 8 to 12 weeks. So for the treatment of this generalized anxiety disorder, the person has to take near about 12 weeks therapy of antidepressants plus anti-anxiety. There is second one is SAD, SAD. This SAD means social anxiety disorder. And the social anxiety disorder, same. Social, as the name indicates, social. The fear of the society. General. So GAD is a generalized anxiety disorder, and SAD is a social anxiety disorder. Selective serotonin reuptake inhibitor and selective norepinephrine reuptake inhibitors are considered first line pharmacotherapy for SAD, that is social anxiety disorders. So here, S for selective serotonin reuptake inhibitor, and here SNRI is for serotonin norepinephrine reuptake inhibitor. So please take a note. SSRI means selective serotonin reuptake inhibitor. So it will only inhibit the reuptake of serotonin, while SNRI, it is a serotonin plus norepinephrine reuptake inhibitor. So it will inhibit the reuptake of both serotonin as well as uh, norepinephrine. These are the specifically, we have the antidepressant lecture. We will discuss detail in this about the what is SSRI and SNRI. This is not our topic, but due to anxiety disorder. And in anxiety disorder, in addition to the anxiolytic drugs, we need to add antidepressants. That's why we are just discussing. But the detailed discussion about the pharmacology of this selective serotonin reuptake inhibitor and serotonin norepinephrine reuptake inhibitor tricyclic antidepressant drug we will discuss in the antidepressant drug lecture. Same social anxiety disorder require extended therapy, and after improvement 6 to 12 month drug maintenance period is recommended for the to avoid the rebound anxiety. And the benzodiazepine should be reserved as the last line agents in the children with the sad social anxiety disorder. Means the children are not able to generally the children's social anxiety disorder uh, for the school. Some children are the fear of the school, they are not able to go in the school. They say that fear, and due to anxiety they are not interested to for the schooling. So it generally occurs in the children, social anxiety disorder in the society. So benzodiazepines, not barbiturates, benzodiazepines with the antidepressants are used in the management of generalized anxiety disorder and social anxiety disorders. And only in the generalized anxiety disorder, if we only prescribe the anti-anxiety drugs, example benzodiazepines, it will not give the proper benefits. So in addition to the anxiolytics like the benzodiazepines, we have to use we have to use antidepressant medications. So this is about the generalized anxiety disorder and social anxiety disorder. So in addition to the benzodiazepines, we need antidepressant medications, and the therapy is near about for the generalized anxiety disorder, uh, 12 weeks, and for the social anxiety disorders near about to the 1 year. Drug induced anxiety. Drugs are common cause of the anxiety. The onset of drug induced anxiety is rapid. The medication history evaluation for the recent drug or dosage change is important to rule out drug induced causes for anxiety. So which are the drugs which causes the anxiety? Anticonvulsants like the carbamazepine, phenytoins, the drugs which are used in the treatment of epilepsy. Antihypertensives, clonidine, felodipine, which are the centrally acting drugs. Antibiotics, quinolines, like the fluoroquinolones, ciprofloxacin, levofloxacin, isoniazid. This is antibiotic quinolines, antibacterial. Isoniazid, the drugs which are used in the management of treatment of the tuberculosis. Bronchodilators in the asthma, albuterol, theophylline, corticosteroids, prednisone, dopamine agonist, amantadine. Amantadine is also used in the treatment of dopamine agonist, treatment of the Parkinson's, leodopa, herbals, mahuang, ginseng, and ephedra. These drugs also having some sympathomimetics activity. Some substances, marijuana, illicit substances, NSAIDs, ibuprofen, indomethacin, stimulants, amphetamine, caffeine, cocaine, methylphenidate, and nicotine, CNS stimulants, sympathomimetics, pseudoephedrine, phenylphrin, thyroid hormone, levothyroxine, and some anticholinergic, antihistamines, and digoxins, which are used in management of congestive heart failures, may lead to anxiety. Thank you very much.